Namaskar, I'm Devanshu Singh and I welcome you all to this special podcast by SOA English Cafe in association with SOA Photography Club for the National Conference on Sustainability and Innovation in Healthcare 2026 in collaboration with CAHO. In this podcast series, we will be discussing about how healthcare can be more resilient, sustainable and innovative. Joining this conversation today, we have Professor Dr. Anup Kumar Samantaray, Pro Vice Chancellor of Shiksha Anusandhan, Team to University. Welcome, sir. How has been your experience?
It's great. It's great. I usually love this. And this is a great seminar. We have taken steps for innovation and sustainability, which is the focus topic as on the date.
Well, sir, let's start with something we all know is a big issue, biomedical waste. So, sir, what new or creative solutions can help hospital manage waste more sustainably? And do we use these ideas actually working on the ground?
Yes, biomedical waste, when we are talking of, it is managing the waste coming out of the hospitals. Because today, mostly we are using the plastics and single-use plastics that we are using. That is a major problem. We have to find a different solution for multiple uses, and every time we are using, because when you look at the saline bottle or when you look at the injection or you look at different other things, mostly it comes with the plastics, and how these plastics can be managed, the waste can be managed, that is most important. And today different technologies have come up, and even in our hospital we are using, because we have got number of hospitals and we are using different technology to carry out the waste, to how to dispose of these waste. These are the most common part, because as the number of patients are increasing, we find it is getting little difficult to manage this waste. Waste management is a vital part of every hospital, because if you do not manage the waste, then automatically the chances that the diseases will be spreading faster. So that is why we need more carefulness, more cautious, so that we can manage our waste in a very productive way. And I think that is also going to make a sustainable development for the hospitals. Because when we are talking in this seminar, also we discussed about these things, and we found that sustainability is a major area where we have to keep an eye, and every time it is increasing. The difficulty comes up regarding what we are going to contribute for our future generation. So in 90s, people were not thinking of that. 90s, they used to think of the quality. Now from 2000 onwards, they have started thinking about the sustainability. So sustainability has become a part of every business, every organization, even in educational institutions. So what we are contributing for the society, the people who are going to come, what they will see or what they will do, that we have to think now.
So, sir, when we are talking about sustainability and also about the biomedical waste that you just mentioned, another topic that comes up is climate change.
Yes.
So, one question regarding that says, climate resilience planning must anticipate extreme events. So, what practical phased measures should hospital prioritize now, like structural systems, emergency protocols to remain operational during heat waves, floods, or prolonged grid outages?
Okay, as you mentioned, that is a very nice question. And when we are talking of sustainability, we also talk of green revolution. Because when we talk of this climate change, we find that most of the time, Odisha as a state, we find cyclone, it is a very cyclone prone, and cyclone problems are there, and your flood problems are there. Of course, flood has now come down, but cyclones are there.
Yes.
And when we face cyclones, what happens? Electricity is gone. Then what we are using generators. So instead of that, we have to go for the greener thing, that is the solar energy. Because in Odisha, solar energy, enough solar power is available, but we have to capture that. Because when we run generators, automatically it has a problem of smoke pollution. So instead of that, if we are using the solar power, even if in case of your flood or in case of your other problems in natural calamities, you can use the solar power. And many states, they have started using solar power in the hospitals.
Yes.
All the hospitals are now, many hospitals, small or big, they are using the solar power. We are also changing our things. Though generators are there for emergencies, we are changing over to solar powers, and most of the things are running in solar power. Even in India, you find certain airports, they are totally powered by the solar power. So that is why we can do that. Lot of things can be done, and this green energy is essential. Another thing, what happens in green energy, what we are doing, you are using certain technology. What happens automatically, if the room is vacant, automatically all the lights are switched off, and when the people come in, accordingly the lights will glow, including the air conditioner, so that you can save the energy, because energy is the most required thing for the future, and that may be a big problem in future. So we have to find also the alternative energies. Not only the solar power, alternative energies are also required. So all the hospitals should focus on different alternative energy, and also focus on handling the situations which come out of the climate change, like as you mentioned, regarding the flood situation or the earthquake situation or the cyclone situation. Because in this situation, you have to use another technology, that you have to reach the rural place. In the rural place, how you will reach? That is because the rural hospitals, maybe Kandhamala or maybe Fulbani or certain hospitals, they are not that developed. So what you will do, you will go for teleconferencing.
Okay.
So you recommend telemedicines. So through telephone, you interact with the patient, and accordingly you recommend those things which will be available. Medicine will be available. Nurses are there. They will take care. But good services can be affordable from Cuttack or Bhubaneswar. That can be done. So that is another technology all the hospitals should adopt, because that again comes under the sustainable development.
True. So, it's really great the way you have explained our viewers about what digital things we are using, and especially about using the renewable energy instead of using diesel in generators for smoke emission. So finally, I'm going back to sustainable health. Finally, looking to the future, what new technologies or innovations do you think will truly change the way we approach sustainable healthcare?
The sustainable health, where as I mentioned, that is mostly the green hospitals. We have to make our hospitals totally on solar power. Of course, generators may be there, but totally on solar power rather than the electric power. So this is first condition. Second condition is that you have to manage your waste in a proper manner, because all the waste create problems not only for the hospital but also people around the hospitals. So that waste management is a big thing that we have to look for. Third one, you have to go for telemedicine system, or connect to different other hospitals where your doctors will be connected to others. So that can be done, because rural places, you have got the problems of hospitals. Many cases I have seen, people are coming from rural cases. Somebody came from Fulbani very recently, I know, he was having accident, then they brought him from Fulbani to admitted in some hospital. Of course, he happened to, he survived, but immediately he was put in ventilator. So these things to avoid, if you are going, the facilities should be provided in rural areas, maybe through telemedicine, maybe through telehospital system, maybe through some system you have to develop by which you can reach the remote places, which is the very vital thing in Odisha context.
Thank you so much, sir. The way sir just put the pointers, they still conceptualize what things we have to do in the future and what things we have to change in the present. Thank you so much, sir. That was a great podcast. It was a great conversation to have with you. Stay tuned with us for further more episodes. Thank you.
Thank you.